Welcome students. Today we will study about remaining part of radiology of abdomen and pelvis. Now come to cholecystography. What is cholecystography? Cholecystography is visualization of gallbladder in radiograph with help of contrast medium. In this study, we use iodine compound as a contrast medium. Cholecystography mainly two types. First is oral, second is intravenous. In oral cholecystography, we use Telepac as a dye. It contains 66% of iodine, but it should not be given to patients suffering from uremia, nephritis, or diarrhea. In oral cholecystography, we can also use orographin. This orographin is new drug. Before oral cholecystography, we need to prepare patient by give fat-free diet and nil per oral, approximately 12 hours. Next is intravenous cholecystography. This cholecystography used for visualization of gallbladder if patient have diarrhea, pyloric obstruction, or any other factor interfere with the absorption of the orally administered contrast medium. In this, we will use bilirubin. It contains 64% of iodine, but this dye not given to patient with hyperthyroidism. In cholecystography, we will take serial films like after 10 minutes, 20 minutes and 30 minutes of injection to visualize common bile duct. And to demonstrate gallbladder should not be take until 2 hours. This is pearl-shaped homogeneous opacity known as gallbladder, and this gallbladder seen in angle between 12th rib and upper lumbar vertebrae. The position can be variable in normal subjects, but if in this cholecystograph gallbladder not seen, then it means possibility of markedly impaired liver function or chronic cholecystitis or pyloric obstruction. In next cholecystogram, you can see this is gallbladder, this is 12th rib, 11th rib, 10th rib, this is L1 vertebra, L2, L3, L4 vertebra. These are shadow of gas. In this image, here you can see gallbladder. This is 12th rib and this is L1 vertebra. Now come to next radiograph to visualize urinary tract. This dye also contains iodine, and this radiograph known as pyelogram. This pyelogram also two types. First is descending and second is ascending. When dye is injected intravenously, it is called descending type or excretory type or intravenous pyelography. But when the dye is injected directly into the ureter through a ureteric catheter guided through a cystoscope, the technique is called ascending or retrograde or instrumental pyelography. Now come to radiograph. This is descending pyelogram, or we can say intravenous pyelogram. Here you can see in this we use warm iodine compound like urographin 60% and Conray 420. After injection, we will take radiograph of abdomen after 5 minutes. and second radiograph after 10 minutes. This intravenous pylography not only performed to obtain an anatomic evaluation of urinary tract but also done to determine the functional status of kidney. So it constitutes one of the renal functional tests. In this radiograph, you can see these are minor calyces, these are major calyces, this is renal pelvis, and this is ureter. This is also descending pyelogram. Here you can see minor and major calyces, renal pelvis, ureter and urinary bladder also. Now come to ascending pyelogram. This is ascending pyelogram. By this pyelogram, anatomic details are more satisfactory than descending pyelogram. But this technique is quite difficult. In this technique, a cystoscope is passed into the urinary bladder through the urethra. Then the ureteric catheter is guided into ureteric opening and passed up to the renal pelvis. And through this catheter, we introduce 5 to 10 ml of sterile solution of sodium iodide, or we can say Conray 280. And after introduce dye, we will take a radiograph, and this radiograph known as ascending pyelogram. Now come to next radiograph. To visualize female genital tract, we use a contrast medium known as lipidol. In this study, we introduce a cannula through cervical canal and introduce 6 ml of radio opaque medium, or we can say 6 ml of radio opaque medium is injected and an antero-posterior film is obtained. This contrast medium first go to uterus and after that it go to fallopian tube and go up to the last portion of this fallopian tube. If peritoneal spill of this contrast medium, then it is a sign of patency of fallopian tube. In this image you can see clearly this is uterus and these are fallopian tubes. Here you can see spill of dye, and this study is useful in case of sterility and to see the patency of the uterine tubes. Now come to last radiograph. This is aortograph and selective angiograph. In this we will introduce dye intravenously. Here you can see abdominal aorta, and this is right common iliac and this is left common iliac artery, and this is right external iliac artery and this is right internal iliac artery. This is left external iliac artery and this is left internal iliac artery. And when this external iliac artery cross inguinal ligament, then known as right femoral artery and left femoral artery.